invoked a measure to ban smoking on the street in case social distancing cannot be respected. And this happened in the region where the infections are increasing faster in Spain. Do you consider this as a setback in the fight against the coronavirus pandemic in Spain? And how could you explain such a decision at this moment? What is the message that this decision sent to people? Thank you.
Thank you for the question. I think your question is a good one, and many countries right now are opening up their societies, Spain included. Many countries across Europe and across the world are opening up their societies. Some countries are seeing resurgence in activity, in transmission, in the form of clusters, in the form of small outbreaks, or seeing increasing in numbers. And this is happening across a large number of countries right now. It is really important that we learn how we can begin to live with this virus, to continue to suppress transmission, be ready to identify any cases and clusters that pop up so that we can quickly put those out so that those small numbers of cases and clusters do not become community transmission again, and minimizing as many deaths as possible. And in doing so, countries may need to implement some measures again. And what we are seeing in a number of countries is that they are choosing to implement some measures in a targeted area, and so in the area where the transmission is happening. They're implementing them for a certain geographic area, and they're implementing them for a certain amount of time. And what we're seeing now is a targeted approach to adding interventions that need to be put in place to bring outbreaks under control and to try to reduce the number of infections that are happening. Countries are doing this in different ways. And they're doing this, and what we're seeing, and the ones where we're seeing some positive effects, is they're doing this in a data-driven way. Where is the virus circulating? What are the case numbers that are increasing? Where is transmission occurring? Is it occurring in clusters? This virus is being driven by outbreaks in clusters. And we see this over and over and over again in countries. They're finding clusters in entertainment industries, in nightclubs. They're seeing clustering in long-term living facilities, in prisons, in certain occupations. And so it is really important that where we know where this virus is, if we know what those clusters are happening, we can bring those under control. So it's how these different types of interventions are put into place, and hopefully these, these will bring these outbreaks under control.
Thank you very much, Dr. Van Kerkhove. So we're coming past the hour. We've only got time for one last question, and it will go to one of our regulars, Simon Ateba. Simon, could you unmute yourself and ask your question?
Yeah, thank you for taking my question. This is Simon Ateba from Today News Africa in Washington, D.C. My first question was answered, so I will ask the second question. Yesterday, personally, I went to try to renew my driver's license here in DC, and the earliest date I received was February 2021. Everything is being impacted, and it's almost obvious that we can't sustain this way of living for a long time. I was wondering if WHO can tell us, one, how long is the 1918 pandemic last, and what's the similarity between that particular pandemic and what we are witnessing now? Thank you.
Thank you, Simon. I will begin, and I hope others will supplement. That's quite a question.